Hello, everybody, and welcome to the second session of the Trinity Challenge Youth Summit 2025. Thank you to everybody for joining us, and we look forward to taking you through the agenda today and into the interactive workshops. We have already run one session this morning, which went very well, and we will be starting the second session now, and I'll just take you through the agenda. So welcome. And just some housekeeping things. So obviously you've got the chat function where you can speak to everybody. We would love for you to introduce yourself and let us know who you are and where you're joining from. And if you have an organization that you're involved in, then let us know in the chat. If you have any questions throughout the session that you want us to answer, then if you drop them in the Q&A, and at the end of the session, we can have a look at all of those. And then obviously you've got things like React emojis and different bits and pieces. Throughout the session, we will be using breakout rooms. If you've joined via a web browser, then you won't be able to go into the breakout rooms. That's one thing that we discovered this morning. So highly recommend you going through your phone app or an app on your laptop or computer, and then you'll be able to fully access the interactive element. When you're in the breakout sessions, what we'd really like is for you to engage with the facilitators. So we have a facilitator and a scribe in each session, and we'll be using a tool called a Miro board. And this will be managed by the scribe, but you yourself will also be able to have access and write notes and comments to support the conversation that you're having in the rooms. So where possible, because we know not everybody has this kind of access, if you can have your camera on, and when you're in the breakout rooms, you can unmute your microphone and you can be part of the active discussion, that would be great. But understandably, we know that people can be accessing this on their phones, and so they might not have that kind of functionality. So the agenda today, first we're going to have an introduction from Dame Sally Davies, who is our chair and founder and the UK envoy for AMR. And then we'll be going and looking at why this topic is so important and why we wanted to focus on it for our second youth summit. And that introduction will come from Professor Mark Mendelsohn, who is the director of the Trinity Challenge. Then I'll give a short overview of the summit and what's going to happen today. And we'll also have a piece there from Rachel Bloodworth, who is our partner at Black Sands. And she will be taking us through the Miro board and what that looks like and how you get the most out of it. Followed quickly by the breakout sessions, which is the interactive element of this event. And then we'll get some feedback from the facilitators in those sessions, just to sort of highlight what you guys have been talking about while you're in the breakout areas. And then we will go to the vote on the final campaign. So you've already taken the list from 5 to 2. Today we're going to discuss 2 different topics, and then you will vote on the final campaign. I'll talk a little bit more about that later. Then we will talk about the competition outline. So the competition is launching tomorrow, and I'm sure a lot of you are here to find out what that looks like, and we'll explain a bit about that then. And then we'll also have a Q&A at the end of the agenda. So on to the next slide, please, Hamish. Our first video is coming from Dame Sally Davies, so I will leave her to introduce why this is so important to the Trinity Challenge. Thanks, Hamish.
Hello, and a happy new year to everyone. And a big welcome to this, our second Trinity Challenge Youth Summit. We really are, all of us, thrilled with the level of engagement and commitment we've seen in response to our first Youth Summit and competition. As many of you know, teams of young leaders from across the world have contributed their own innovative ideas to tackling antimicrobial resistance, and some going on to win seed funding for their own campaigns. But let me say, all the teams have contributed to the discussion and helped build this community of committed young voices working on this crucial issue of AMR. For those of you who haven't previously joined a session with us, the Trinity Challenge, I want to briefly explain who we are. I founded the charity Trinity Challenge in 2020, and it was as COVID and the pandemic was showing us how urgently we needed not only better data, better analysis and tools, but improved collaboration. And then that would help us, I believe, be better prepared for global health crises. As many of you will know already, this antibiotic emergency has been gaining some visibility across the political agenda, and new reports have highlighted the severity of the challenge that we face with AMR. However, we must all of us ask ourselves what role we can play in using our own strengths, we can play in our own communities, that we can play to address this emergency. Already millions die each year from AMR. Indeed, the Global Burden of Disease study shows us that AMR is the third leading underlying cause of death after heart disease and stroke across the world. That's awful. It's preventable. Today, we're here not just to talk about AMR broadly, but actually to focus on an area of the response that needs our attention, particularly yours, AMR in the food chain, in rearing animals. More than 400,000 people die every year from foodborne diseases, and of those deaths, over 1/3 occur in children under the age of 5. Most foodborne illnesses are caused by microbes, including bacteria. So you can see that as these bacteria become increasingly resistant to antibiotics, it will become much more difficult to treat these illnesses, and more people will die from foodborne diseases. And actually, that's exactly what we saw a few years ago in Hyderabad, in Pakistan, with typhoid. There are, of course, implications beyond human health. The spread of resistant infections in animals leads to preventable animal suffering and deaths, of course. And with 1.3 billion people relying on livestock for their income, AMR has the potential to devastate economies and those individual family lives. While we must do everything we can to mitigate the antibiotic emergency and AMR, we know that our mission will never be over. We need to keep finding ways to educate everyone, to prevent infection, to understand how AMR is working in our communities, and communities vary, and to harness emerging technologies. This means we have to absolutely rely on you, the young people, that you are the leaders of the future. You need to take ownership of the issue, and we want you to drive meaningful change. Through today's summit and the following competition, we hope to harness your enthusiasm and energy. We believe there's a pivotal role for the perspective and contribution of youth leaders and youth-led organizations in driving meaningful change. We've seen it work before. You can do it. As I said to those of you who joined us last year, young people are crucial because of your fluency and adaptability in our ever-changing digital world. Your fresh perspectives and creativity matter, but most of all, because your voices are important. You have the power to influence your peers, your communities, and policymakers. So use them. So as you take part in this youth summit, we encourage you, as always, be bold, be curious, be collaborative, share your ideas and learn from each other, and don't be afraid to challenge yourself. Challenge yourself to be the best you can. I want to thank you for your dedication to this cause of AMR. By being here today, you're taking steps towards a healthier, safer world, which you deserve. So let's make this summit and the ideas that come from it. The resounding success you can. Thank you.
Thank you, as always, to Dame Sally Davis, our chair and founder, who really puts so much energy into our youth engagement work and really has supported this from the beginning and is a big driver in continuing the youth engagement work that we do. And one of the reasons why we're able to hold a second summit and competition this year. So next, we're going to hear from Professor Mark Mendelsohn, who is the director of the Trinity Challenge and an infectious disease doctor professor in Cape Town in South Africa. He's going to be telling us a bit about why this topic is important, why we decided to choose it, and maybe give you some inspiration as to what you might focus on for the campaigns. So thanks, Hamish, and we'll hand over to Mark.
Hello, my name is Mark Mendelsohn and I'm the director of the Trinity Challenge. I'm really delighted that you've been able to join us for this second Trinity Challenge on AMR Youth Summit. So much of our time in thinking around antibiotic resistance relates to human health itself. But of course, antibiotic resistance is a One Health problem. It affects humans, animals, and the environment. This youth summit, we are focusing on animal health and antibiotic resistance. And of course, that doesn't just encompass food security and food production animals, which we often think of, but also our companion animals, pets. Now, antibiotic resistance is threatening both our companion animals and our food security. And it's in food security that we're going to see the major impact. Indeed, in the next 25 years, it's estimated that between $0.5 and $1 trillion will be lost in cumulative gross domestic product. That's unsustainable. So we need new approaches to mitigating antibiotic resistance. But we don't need to just think about it. We need to actually develop action to indeed mitigate this problem. That's why we're looking to our youth, to you and your colleagues, to drive thinking in this critical area. Whether it's improving biosecurity on farms, i.e. infection prevention to stop animals becoming sick in the first place, or infection prevention either in clinics or in the home for our companion animals, or the way that we use antibiotics, often called antibiotic stewardship, but it's really optimizing the use of antibiotics in companion animals and in food security and food production systems that we're interested in. So think laterally, good luck, and I hope that your deliberations and solutions will be both wonderful. Thank you.
Thanks as always to Professor Mark Mendelsohn for his expertise and guidance on these issues. Mark was one of the judges on the first Youth Summit competition that we did, and I heard a rumor that he might be joining us for a second year in a row, so watch this space. So now I'm going to give a quick overview of the Youth Summit and what will be happening today. I think I might have forgotten to introduce myself earlier. So I'm Jenny Smith and I'm the Events and Communications Manager for the Trinity Challenge and have been leading on the youth engagement work that we've been doing over the last year or so. So if we can go to the first slide, please, Hamish. This is just a little introduction to what the Youth Summit 2025 is about. So we had two sessions. So we had one session this morning and one session this afternoon. The two sessions will be exactly the same, except for your conversations will be different in the room. We have a few different facilitators, but otherwise it's the same agenda. We just wanted to open it up to a global audience and try and fit in with the time zone differences and get into the agenda of different organizations and people. We will be voting again, as I mentioned in the agenda. So we've got when we first decided to do this topic around effective use of antibiotics in the food chain, we asked that big question. And then underneath that, we went through the priorities of different global organizations and found 8 topics that were sort of pertinent to that discussion and were priorities across the world for different organizations. We held a stakeholder forum with some of those key organizations, and we took that list down to 5 priorities. And then a lot of you who registered in advance will have received a voting email, and you will have taken that 5 down to 2. And so we now have 2 main areas that, again, I will introduce in a second. But we need one final topic for the competition that will launch tomorrow. And so after the breakout sessions, we will be doing a vote. And so when you're in the breakout sessions and when you're having these discussions, I want you to be thinking, what will make a fantastic global campaign? What will make a difference in raising awareness for AMR? And have those thoughts in the back of your mind when you do the final vote this afternoon. And then just again on the breakout sessions is that we really want them to be engaging and participatory, and we want you to get the most out of those. So we'll really do as much as we can to facilitate that, whether you are able to turn your camera on and unmute your microphone, or whether you need to use the chat function to get your voice across. Either of those options is fine. If we can go on to the next slide, please, Hamish. So these are the 2 topics as voted for by you. So we have antibiotic stewardship in agriculture, and within that topic, we're looking at how can we find AMR champions within the farming community to encourage peer learning on ending antibiotic use for growth promotion in farm animals. They're both really snappy titles. So the second one is promotion of biosecurity, including vaccination best practice. And within that, we're looking at how can we promote the use of prevention methods, including vaccination, nutrition, and good animal care to replace the need for antibiotics. So those are the 2 topics that we're going to be discussing today. And we've got 2 breakout sessions, 2 breakout rooms dedicated to the antibiotic stewardship and 2 dedicated to promoting biosecurity. And you will be automatically allocated into one of those groups. If you are really wanting to be in the other group and looking at the other topic, then you can just send me a direct message and I'll try and move you. Obviously, we don't want lots of people moving, so it's only if you're really needing to do that. So if we go on to the next slide. So this is the first topic that we're looking at as voted for by you, and our head of communications and engagement, Charlie, has helpfully pulled together a few sentences underneath that explain a bit about the topic. So if you're going into this topic quite fresh, then these are just some useful sort of information bites that you can absorb before going into the breakout session. So we just wanted to tell you about that a large part of the food industry relies on healthy livestock. As antimicrobial resistance grows, this will affect food production, increasing production costs and increasing consumer costs for us, everyone in the supply chain. Antibiotics are fed too routinely to the livestock that we eat. They're used indiscriminately in large amounts as growth promoters. As with humans, livestock excrete antibiotics into the environment that they live in, which increases the level of antibiotics within our water and food systems. So we know that the use of antibiotics in farming drives resistant bacteria in livestock, which can be transmitted to farmers, workers, their family, as well as to consumers at the end of that supply chain. So really important topic. And then finally, antibiotic stewardship in agriculture is the practice of ensuring that farmers and other professionals and decision makers of food production and people within that system, working within that system, use best practices to mitigate antibiotic resistance and its impact on human, animal, and environmental health. So that's where you can see that One Health approach really bringing all those elements together. So these are just a few things to consider as you go into the room, into the breakout sessions, and have these discussions. So moving on to the next slide. Thanks, Hamish. This is the next topic area, and again, Charlie has helpfully pulled together some information, bite-sized information for you to think about. So the first point is that biosecurity refers to a set of precautions to prevent the introduction and spread of organisms which could harm human, animal, and/or environmental health. For example, hygiene practices on farms. So already this topic is bringing in that One Health approach. One of the economic benefits of biosecurity, it avoids costly losses because when you have sick animals, obviously, the animals have to be culled, and that can reduce your production. So it also can reduce the risk of zoonotic diseases, which are infectious diseases that can be transmitted between animals and humans. So these diseases are caused by a variety of pathogens, including bacteria, viruses, fungi, and parasites, and can spread through direct contact with infected animals. It can also be consumption of contaminated food or water, bites from insects, or exposure to environments contaminated by animal waste. The second to last point there just explains that good biosecurity practices can also aid in a sustained market access. And this is through the compliance with export and trade standards. And then finally, by adhering to robust biosecurity protocols within the farming industry, within the food industry, farmers can minimize risks to themselves and to their animals, improve animal welfare, and ensure sustainable farming practices for the future. So those are just a few things that we want you to think about sitting underneath these two topic areas as you go into the breakout sessions. So if we move on to the next slide. Okay, great. So this is just a reminder about the group work before I hand over to Rachel, and she shows you a bit about the Miro board. The rooms will be automatically assigned and you'll go into a breakout room. We will share the Miro board links in the chat now so that you can access that directly. If one of the team in the background could just put the links in the chat with the relevant room, that would be fantastic as we explain. And it just means that you can access that and you can type in yourself. So Rachel's going to walk you through this in a second. As we've said, if you can turn on your microphone and you can turn on your camera, then we'd love to see your smiling faces. And it helps to the facilitators and the scribes to know who's in the room and to see your faces. And finally, like we say, you can write directly onto the Miro boards, but yes, Rachel will talk you through this. If you lose connection when you're in the breakout sessions, don't worry, just come back into the session and drop in the chat which room you were in, and we can get you straight back in there, no problem. So don't worry if you need to log off and log back in again, that's fine. Okay, so now I'm going to hand over to Rachel. And while Rachel's talking, I can drop the Miro board links into the chat. Thanks, Rachel.
Thanks, Jenny. Hi, everybody. Rachel Bloodworth from Black Sands Communications. So, Miro, hopefully you might already be familiar with it, but it's a platform that's going to help us to track the conversation that you're going to have in your groups. So, as you can see on the screen here, you can see the campaign topic at the beginning, which will have a recap of the question for your group. And then there's 4 tasks that the conversation will follow through. When you are in Miro, as Hamish is just showing there, you can just scroll along with your arrow to get to each end of the board. And Hamish, if you could also zoom in on the screen, you can see that you can go closer in and make those bigger as well. To use the post-it notes, you just do a double click and then you can start typing on any of those, and feel free to change participant number to your name as well. And for anyone who can't edit the Miro board directly, you can put your comments into the Zoom chat function, and then the scribe in your breakout group will help to put your comments onto the Miro post-it notes. Just a note for any new scribes joining us for this session that you can't copy and paste those, you will have to type straight onto the post-it notes. So when you come into the room, everybody, there will be a link to the Miro board, so you can click through and have it on your screen, but also your facilitator or your scribe will have it on the screen as well. So if you can't load Miro, you can still follow it through Zoom itself, although obviously you won't be able to then live edit. I think that should be everything, except just to point out, thanks for the prompt, Hamish, that on task 2, there will be some voting if there's time in your group. And to do that, you just copy and paste and just drag the dot over to the post-it note that's got the information on it that you are voting for. So you just either cut and paste or drag the dot. It's quite an intuitive platform, thankfully, to use. If you have any problems during the session, you can also ask your facilitator or your scribe for some help to navigate the functionality. I think that's enough from me, so I hope everyone has a really good discussion.
Thanks so much, Rachel, and thank you to Hamish for being our demo person. So now I will open the breakout sessions, and like I say, you will be automatically allocated. If you absolutely want to be in the other room, then please just drop us a message and we will try and move you. But have a great time, and we will see you in 45 minutes. Thanks, everybody. And I will put a reminder in as a broadcast when it's 15 minutes till the end. Thanks, everybody. Hi, everybody. Welcome back after the fantastic breakout sessions. If everybody can turn their cameras off and make sure they're on mute for the recording, that would be fantastic. So I hope that you've had a fun, brilliant conversation in the room, and sorry that I couldn't join, but we were just trying to make sure that everybody was where they needed to be. So now we will move to get some feedback from our facilitators. So we just want to understand a little bit more about the conversations that you guys were having in the room, and some of the key points, some of the most popular ideas that came up and cropped up during your conversations. So I will go in order of the rooms as they were allocated. So the first session was facilitated by Ohemu and Liz. So if you guys want to come on camera or unmute yourselves, and you can talk us through what happened in your room. Thanks, guys.
All right. Thank you so very much, Jenny. And hi, everyone. My name is Ohemu Godwin Pius, and I worked with my colleague Liz, and we guided the conversation that took place in this particular group. Our campaign topic, as you can see on the screen, was antibiotic stewardship in agriculture, and we discussed around how we can find AMR champions within the farming community to encourage peer learning on ending antibiotic use as a growth promoting agent in farm animals. To the first task that we are given to answer, we're asked, what does success looks like for us if peradventure we implement this initiative, if peradventure we find champions who can actually help to cut down on the use of antibiotics as growth promoting agent in farm animals. So we got 15 wonderful ideas from our participants. This is similar to what we had in the morning. I'm amazed. So for all success will look like this. Number one, if we have effective use of antibiotics and treatment of animals, and this to us will lead to less resistance, less emergence of resistant bacteria infection. We also feel that success for us, if this idea is implemented, will lead to better knowledge and training, reduction in antibiotic use, control sales of antimicrobials in pharmacies, educate the population about AMR and sustainable agriculture practice, particularly proper use was resurfacing again and again, and we believe that this will reduce the cost of bacteria infection. We also look at post-secondary graduates in bioinformatics with close ties to farm. These individuals will actually be enlightened, and if this enlightenment is done, we'll feel that we'll have success. And then lastly, we'll have sustainable farming practices. So this is what success looks like for us, and it was key. These were wonderful comments that came in from participants on the call. To tax 2, we looked at who are the individuals, or who are the people that have the power to create change. For us, we believe that the farmers, as you can see an exclamation mark in front of the word farmers, because they are the people who are at the bottom of the whole issue. So the farmers, and this we believe will lead to behavioral change in practice, in the use of antibiotics in farm animals. Then global health policymakers and educators. We also look at doctors, vets, pharmacists, and in the sense that these individuals, they play a great role in engaging with farmers. Veterinarians also play a crucial role. Agricultural organization and association will be involved, since they have the capacity to train and provide training for farmers. And we didn't leave out the involvement of the media. The media can actually pass the information across to the farmers, and it will be of great help. Then to tax 3, please. To tax 3, we looked at how will you reach the priority audience from those that we've just listed in the previous task. So we, first off, a very key conversation that came up was that you don't just you don't just go to the farmers. You don't just go to the farmers and then you tell them stop using antibiotics as growth promoting agents. They are rearing animals, some of them for business purpose, and they want to make profit from it. So when you tell them not to use antibiotics, it's more like you are against their business growth and development. So the ideal thing, first off, is for you to offer an alternative. So we are looking at offering an alternative to antimicrobials, and then we also look at how we can consider cost and the cost and benefits to the farmers for using these alternative proposals, and then the farmers can on their own generously withdraw the use of antibiotics. Social media campaigns, community outreach, and face-to-face conversation with farmers. We also need to do a need-based analysis to find best strategies and message for farmers that is working with their priority. We also look at how we can use school programs and curriculum to get message across. And very importantly, a colleague of ours from Zambia shared a perspective that an idea that they have used lately in terms of reaching farmer in the rural area, since they do not have access to social media and they may not be well enlightened to use the platform, is to use traditional leadership groups, like those in the church, those in the market, and those in the community. These leaders, they have influence in the society, and when you use them and you pass information through them, it gets to the farmers directly. So these are the channels that we identified as per how we can land our message, or we can get our message to the priority audience. Then finally, on the subject matter of what is the key message that we want to land with our priority audience, to us, we want clear actions and consequences articulated. We want to articulate the clear actions that needs to be taken, and then what are the consequences of abuse, misuse, and overuse of antibiotics in farm animal, and then encourage farmers as per best practices. We want to change the way we produce and make it clear to the farmers that this decision is urgent, as abuse in the use of antibiotics as growth promoting agent in farm animals does not only affect the animals or the farmers, but in a One Health approach, it affects humans, it affects the environment, and it affects plant as well. So we propose that it would be good for us to use simple language to communicate our message to the farmer, because antimicrobial resistance is more like a microbiology term, and not all of the farmers are well enlightened to understand that. So we propose the use of simple language, simplify the conversation, and then finally, a colleague of ours proposed that we use storytelling. We use storytelling as an avenue to get the message across. Share success story by highlighting the benefits of prudent use, and then the disadvantage or the consequences of abuse of antibiotics. And then act now. Act now. We don't need to act tomorrow. We need to act now to save money and to save lives. So these were the feedback that we got. It was a very nice conversation with wonderful ideas, as you can see on your screen. Thank you so very much to our scribe, Liz, who did an excellent job taking note of all the points that were raised. And thanks to the team too for their wonderful contribution. Thank you.
Okay, first time that I've spoken with being muted, so that's a good going. Thank you to Ohemu and Liz, who are a fantastic team, and we really appreciate you summarizing what looks like a very detailed, in-depth conversation. So thank you for the feedback. So our next pair of scribe and facilitator who will be feeding back to us are Emily Jones and Susanne Ayal. Apologies for the mispronunciation of your name there, Susanne. If you'd like to unmute and come on camera, and whoever is able to share screen, and you can talk us through what happened in your breakout session.
Okay, can you see my screen?
Yes, we can see it. Perfect. Thanks.
Okay, so hi everyone. We are also talking about the same topic, and the most of the discussions and the point we had in our group is almost like presented and kind of similar from the breakout sessions of first. So when we're talking about what does the success look like from this program, so the few points that we came into conclusions were like the satisfactory number of farmers who became AMR champions, and there would be reduce misuse and abuse of antimicrobial resistance in farm, and creations of multiple multiplier effects. So educations also, from other colleagues we hear that education on the importance of farmer issues and consumers. So we thought that there would be even consumers and farmers would be able to learn from it, and there would be like the reductions in infectious superbugs cases in the future. So nations and government might adopt the policies within their nations. There would be increased awareness among livestock farmers and consumers. So these are kind of similar points we came into conclusions with. And also another point we had was like the establishment of AMR surveillance systems in a food chain to track and monitor antimicrobial use and resistance pattern in livestock and crop, and integrations of this data is in One Health framework, enabling the crosswork sections collaborations. So after this, the second question was who has the power to create the changes that we discussed in a first topic, and there were quite a few suggestions from our team members, but few like the top four we agrees were uh, the farmers, as we believe that the farmers are also like the lower chain, and they are the one like who needs to adopt it if we are talking about implementing um antimicrobial antimicrobial stewardship in a farm. So they are the first priorities, and the second one would be the local leaders, is they can influence the community and farmers, and also like they are the one who can suggest government to make a policies and policymaker to adopt those policies. Even from the government side, we believe that the Ministry of Agriculture and Livestock Department are the one like who are responsible to create the policies and bring changes in the field. Uh, at the same similarly, those who are involved in the professions like as veterinarian or one health expertise, the kids that will become the future professions are also like have power to create those changes. And we believe that media team same as from the team one could bring the changes. Other changes can be brought by the NGOs and INGOs as they could help government and even farmers by funding the project and managing the projects. So the third questions on how will you reach to the priority audience from those we have discussed. We believe that since right now like we are using social media a lot and everyone has almost everyone has access to the internet, so reaching out to them through YouTube and Facebook or even through the social media campaign would be crucial. Similarly, just to understand the farmer from ground level, doing a physical community meeting under the influence of local leaders could be beneficial. We believe that providing the capacity building trainings and workshop for the vets and experts is also crucial, and proposal writing and officials meetings for NGOs. So data visualizations and storytelling is the way by which like we could communicate with our audience. Even if like we don't have internet facilities, doing interviews and uh, radio shows could be beneficial, and we would be able to reach out to the farmers from farmers in the rural areas too. And also we personally believe that using a rural sociology tools and communications tool could be crucial. And even in some continent, if I'm talking from Nepal, writing a petitions and doing a peace protest help us reach out our language to the government. So these are few points we discussed over here. And at the last, we discuss about what is the key message we want to land to our priority audience. Those were each stakeholder should be informed on the following things. And we for farmers, it was mostly like how they could become an agent by adopting the changes and using the antimicrobial uses. And for NGOs, like how they could solve the health problems by improving the AMR challenges. And antimicrobial, I believe that this point is crucial, is antimicrobial resistance is a one health crisis. So use of excessive antibiotics in farmers also pushed humans and other sector as risks. And this is crucial information that we want to learn to our targeted audience. And also like there are other alternatives that we can use as a growth factors and for the prevention of infections rather than antibiotics. And we should look for the alternatives. This was all from our group. I'd like to thank Emily for assisting me and also those who participated in these sessions. Thank you.
Fantastic. Thank you so much. Again, really interesting conversations, obviously, going on in all the breakout sessions. So it's great to get the feedback. Also, I'm just reminding our audience to be thinking about all of these things, all of this feedback, and if you think that that would make the best campaign, and following this feedback, we will be going to the vote. And so just keep all of these things in mind. So our next feedback from facilitators is coming from Nilofer and Rachel, who were working on the promote biosecurity, including vaccination best practice. If you guys want to unmute and come on camera and share your screen, that would be fantastic. Thanks.
Thank you so much, Jenny. I'm trying to share, but I think, can you see my screen at all? It looks like it's a bit frozen on my side. Apologies.
No, we can't see it. That's okay. I can try and get up your...
I can do it also if helpful.
Okay, yeah, Rachel, if you've got it there, that would be great.
Thank you so much, Rachel. Great. Hi, everyone. Thank you so much for having us again. We had a really robust discussion that I personally learned a lot from. I would say that I can implement in my work from group 3 on biosecurity interventions, including vaccination, nutrition interventions, etc., to ensure appropriate use of antimicrobials in the food chain. So the first question was, what does success look like? And for me, what 3 key messages stood out in this piece, and I'll go into detail on what each of those were. So first, there was agreement that community interventions are a big piece of what a successful AMR campaign can look like, and that would not just include members of the general public, but also children and families. And so targeting those interventions specific to the needs of the region, needs of these communities and countries is important, and having a top-down and bottom-up approach in balance. And to that end, we spoke about raising AMR awareness in young people. We spoke about inspection of animal products and implementing and advocating for judicious and appropriate use of antimicrobials in the community. And within that, we spoke also about engaging with different sectors and actors to come together to develop awareness on AMR, both in terms of use of antimicrobials and also how there is cross-learning and cross-sharing of best practices. And that the second key broad banner of messaging that stood out for this question was engaging with different actors and different stakeholders, and not just not just specific to health and animal sector, the food sector, of course, WASH as well. And under that, we spoke about talking about research and development pieces of antibiotics and alternatives like vaccines to prevent infections. So basically expanding on the research and development pipeline and supporting towards that. And ensuring that antibiotics are only prescribed by veterinarians, and developing their capacity to adhere to standards and protocol in place on use of antimicrobials. So overall, broadly speaking, developing capacity essentially of health workers, veterinarians, and other practitioners in the space. We also spoke about promoting responsible and judicious use of antibiotics, as I mentioned, in livestock, as a way to leverage and gain momentum on promoting strong AMR stewardship actions. And to that end, also addressing issues such as drug withdrawal periods and stuff, and unique challenges that are faced in the animal industry on addressing that without using antimicrobials too much and mitigating on use of antimicrobials in the first place. Let's see, we also spoke about, of course, engaging high-level actors, political actors and adjacent actors, ministries and et cetera, and including civil society and other stakeholders who engage with these actors. And to that end, making sure that public health action is concerted on food, animal health, human health, and all of these parameters, and engaging more robustly on creating regulatory structures and really advocating for implementation of those regulatory structures, and not just existing in principle by way of building awareness on what adherence to the structures, regulation, and protocol can look like, and what that can look like in practice for practitioners and others involved in the space. We spoke about also, while developing capacity, also working with different sectors, again, animal, human health, food security, and other areas, maybe climate change and WASH as well, and talking about how these different actors can come together to create more political buy-in, et cetera, to address the issue of overuse of antimicrobials. And within the community action piece, I also want to highlight, we spoke about keeping language simple and keeping communication materials simple so that they are more accessible for the general public, et cetera. Okay, so those were some of the key points that stood out from task one of what successful campaigns look like. So we'll move on to the second question, and who has the power now to create change here? Again, it was a good balance of top-down and bottom-up approaches. I'll start from bottom-up. We talked about health workers, farmers, veterinarians, consumers, of course, having great leverage to drive change and results, civil society. I like the idea of police officers as well to help and create change. And of course, top-down, we have government actors, and I'll come into that in a bit. In terms of non-government actors, pharmacists also came up quite prominently in our discussion, particularly in terms of addressing issues around regulation of antibiotic use, where they're used, how they're used. If there are regulatory structures in place, why are they not being adhered to? If that is indeed the case, issues on substandard use of antimicrobials, etc. And within that, we also address the issue of building capacity of these different actors we spoke of. So that's mostly the community health and practitioners space. And now we'll talk about top-down approaches, which is governments and other actors. Within that, we spoke about building cross-sectoral collaboration between government ministries, getting agriculture ministry to come together and work with the health ministry, for example, and involved to create a cohesive action on AMR, because these ministries can often work in silos and be quite disenfranchised from each other. And how do we bring them together? How do we connect those dots? We also spoke about private companies and private pharmaceutical companies coming together to expand on novel line of antimicrobials and vaccines to prevent infections, which I think takes a bit more of a balanced approach in the top-down and bottom-up spectrum of action of things. And I'm looking here if I missed anything. Youth, of course, came up a lot again in terms of community actors, youth, civil society, public figures using community leaders as well as champions for AMR and addressing AMR issues. And within that, we also spoke about women and children and addressing families as well as we drive change towards AMR. And students and using different media to access these different actors and stakeholders. So which brings me to the third point on how will we reach the priority audience from what we've discussed. Media was a key point that came up, social media, print media, online media, TV, radios, etc., and targeting these campaigns using not just social engagement, but also engagement for specific communities that are disenfranchised or marginalized, such as women and children and internally displaced populations, for example. So really creating a targeted media outreach, that was one key message. And then we talked about we create media outreach, make sure it's accessible. And that can be done by way of using language that is understandable and more uptake, local contexts, etc., making information on AMR very accessible for the general public. So that's one key piece. And within that, we also spoke about doing meetings and workshops with local leaders, etc. And then we got a bit creative, which was really fun, on how we can use drama and plays and performing arts to reach audience of focus, which I think was really fun and interesting, something I didn't think of myself in my work, which was great. And then we, of course, talked about developing research rigor on AMR. Data is quite lacking on AMR. Real-time data is quite lacking for a lot of regions. So how do we build that? And that can be done by publishing more on AMR and doing more case reports, etc. And yeah, and I think I would also mention community campaigns that include schools and yeah. So those were points on number 3. Now let me go to the last one. Now, what is the key message you want to land with the priority audience? Here we were pretty comprehensive, so I'll try to summarize. The first key message was that there is a role for future generations to be part of this fight and understand what AMR is and what good consumption practices look like, and really advocating for that, not just within communities, but also, you know, the actors within those communities, families and nuclear actors like children, women, etc. And then we obviously had a very strong ministerial political leadership involvement messaging, and to do that, highlighting to the ministries what regulatory structures and documents exist and what adherence to good drug protocol is like, and really developing capacity with health practitioners and animal actors, etc. In that role. And then there was a big message on the economics of it as well, that prevention is always much cheaper and much better than treatment. So aligned with that, prevention practices, what can we do community level? What can we do from a government level? What can we do even from a pharmaceutical engagement level to prevent infections in the first place, that will reduce the need of antimicrobials first. So that was another broad message that came up. And then I think, and of course, I mentioned about education being a key part of this change. I liked also that sanitation and hygiene also came up as one of key messages, that AMR is not an issue specific to health, animal health, and food sector, but also WASH practices to reduce disease breakout, and that can be implemented in good animal husbandry practices, etc. And I think those were the key messages that we can summarize for the last point. Overall, it was, I think, a very joyful and robust and comprehensive discussion. Thank you so much to colleagues in breakout room 3, and all of you, you know who you are, and to Rachel for doing a fantastic job that I wouldn't have been able to do and type really fast on the Miro board. Thank you so much.
Thank you so much for that very comprehensive overview of what was going on in your breakout session. It sounds like another fantastic conversation, and lots of detail there for you guys to be thinking about before the vote. So now we go to our final facilitator pair. We've got Sophie and Hafiz, who will be Sophie's there to feed back for us. Fantastic. And Hafiz is sharing screen. I can see. Brilliant. Okay, I'll hand over to you now, Sophie. Thanks.
Thanks, Jenny. Yeah, so in our room, we were discussing the topic of promoting biosecurity, including vaccination best practice. And we had a really good discussion, some really great contributions. So to start off with thinking about the first question, what does success look like? We discussed things like having a good education and training program as an outcome, kind of specific measurables, things like reducing antibiotic usage and reducing vaccine hesitancy, especially for use in animals. We discussed kind of reaching farmers specifically, increasing their awareness and hygiene practices. But also not just increasing awareness, but how that might lead to some changes in attitude as well. And we also discussed having some guidelines for appropriate antibiotic use and mentorship for farmers as well. Sorry, I'm just moving a post-it note. To go on to the next topic of who has the power to change and to kind of bring about those outcomes that we discussed before. We discussed lots of different kind of communities or groups that we might want to target with this. Farmers as one, communities and leaders. We had a good discussion about how there's often a disconnect between the sort of government and policymakers and actual communities and people who we might want to reach more directly. And we had some really good discussion as well about how the youth are a group which, as this event is attesting to, have a lot of power, hold a lot of power, and how the youth kind of advocacy may be an audience that we want to focus on, and how consumers as well hold a lot of power in opposition to sort of policymakers. But on the other hand as well, we did discuss kind of the government and legislators and specific kind of country collaborators as well, as international organisations and NGOs too. So sort of broad range of different audiences. But when we had our vote, we kind of decided to focus on farmers as a key audience. So to move on to how we will reach that audience. So like I said, we were discussing farmers specifically. We spoke a lot about the kind of need for on-site or in-person engagement over necessarily maybe media. So we were talking about workshops, offering support services and potentially through vets and healthcare practitioners as well. We spoke also about farmers associations and trade associations and how those organisations might be a good kind of route to actually reach the farmers as an audience. We also spoke about creating incentives for good practices and some interesting suggestions around how we might employ kind of non-formal education tactics to reach those audiences. So things like gamification and also building skills and capacity as well. And I think, oh yeah, youth-led advocacy program. So again, utilizing that kind of youth audience to bring the message across. And from the voting, we were, I think the things that kind of came out as being priorities were, like I said, the more kind of in-person or on-site engagement and working with organisations like farmers associations. So to finish off, we had some really fantastic suggestions for kind of key messages for a campaign like this. Tackling AMR needs a collective effort, emphasising the role of individuals in tackling such a kind of big issue. Healthy animals means healthier food and a safer future. It's a really nice message. About so prevention as well, and prevention saves lives and saves money. We also discussed how some kind of specific topics we might want to focus on specifically is about the use of prescribed antibiotics and disposal of excess medicines as well. Really nice one, healthy farming means healthy ecosystems. So we discussed taking a One Health approach to the campaign. And again, protecting our populations, ensuring safe food systems and securing a healthier future for all. So yeah, some really lovely messages to kind of finish off our discussion. Yeah, thank you everyone for your contributions, and thanks Hippies for your help with recording everything.
Brilliant. Thanks so much for the feedback, Sophie. Another great perspective there. Also spotted one of our 2024 cohort winners, Damalola, in the notes there, I'm guessing. So thank you to winners past and present for joining us. So thank you to all of our facilitators, for everybody who joined in the conversation, shared their thoughts and opinions and ideas on what are two very important topics. Obviously, there's a lot to unpack with both of them. So now I just want you to keep those things in your mind while we do the vote. So the vote will come through Zoom. If you get prompted to take your vote and answer the question, then that's great. If you don't get that, then feel free to just pop in the chat whatever your vote is, and we will make sure it's considered in the final numbers. So we had the vote this morning at the morning session, and then we'll have this vote now, and then we'll add the two scores together and have the final result for which topic will go forward as the competition topic. So as you can see, Hamish has put up on the screen there very helpfully the two topic areas that we have. I will launch the poll now, and hopefully you can all see it. Okay, we've had quite a few votes in, still lots coming in though. If you are not seeing it, then like I say, please drop it into the chat. Okay, we've got a few more people who need to vote, so I'm going to leave the poll open while we just go on to the next section of the agenda, just to make sure that we are finishing on time. So if you haven't voted yet, vote using the voting tool, and if you haven't seen the voting tool pop up on your screen, then just drop into the chat if you want antibiotic stewardship or the promotion of biosecurity to be the topic for the upcoming competition, which I will outline for you all now. So if we go to the next slide, please, Hamish. Okay, so this is just a sort of timeline overview of what comes next. So obviously we finished the summit today and we launched the competition tomorrow. And then there's 2 weeks for you to get your team together, further develop your ideas, and complete the application form online. Everybody who has attended the event today will receive an email with the relevant links and information, and all of that will also go onto our website tomorrow. So application deadline will be Wednesday, the 29th of January. And then we internally will go through the judging process with our team and also a panel of expert judges who we have recruited. And then we'll do due diligence on the winners to make sure that the organizations match with the criteria that we've outlined. And then we will announce the winners in the spring. And then those teams will have more time to develop their plans further, work with the Trinity Challenge and some of our partners, for example, Black Sands and others. And then you'll be able to finalize those. We'll hold a winners event so that you can again further engage with each other, learn from each other, find out what's going on in the different global regions. And then the campaigns should aim to be delivered within 6 months. And this is from the point of receiving the grants. So we would love to have your application, your ideas, and see what people in different parts of the world are coming up with on these topic areas. So if we go to the next slide, please, Hamish. So just to let you know that these are the 7 regions that we work with as per the World Bank definition. What we really want from this competition is to have global representation. We really, in an ideal world, we would want 1 winner from each region. If that's not possible, because we don't get applications from there or because the quality maybe isn't as good as other areas, then we'll try our best to get the best global representation that we can. So if we move on to the next slide. So the eligibility criteria, and we'll put the full eligibility criteria on our website so you can have a read through and make sure that your team ticks all the boxes. But what you really need is teams of 3 people or more. And the majority of those people need to be young people. This is a youth summit, a youth competition, and we really want to try and fund youth-led projects. So the majority of your team need to be 18 to 35 years old. And then you'll be able to, like we said, bid for the grant funding, and there are 7 pots available, 1 for each region, and each of those is up to £7,500. And that will then to be available to deliver your campaign over the following 6 months. Second key point is that the teams must be part of or associated with a legally registered organisation. And that organisation would be responsible for the contracting with TTC and also for the grant management, so managing of the funds. And so this, for example, if you're an AMR student group and you have a university that can manage those funds for you, then that's the kind of thing that we are meaning. But if you've got any questions about that, then if we go to the next slide. Okay, then, so this is the evaluation criteria. So the judges that we're working with will be looking at this criteria when they're judging your application. So 5 key areas plus the global representation element that we mentioned earlier. So the first is innovation. So we're looking for creativity, originality. We want to know what the impact is going to be of your campaign. We need to know that it's practical and sustainable. So we'll be looking at the feasibility. In terms of collaboration, we want to make sure that you're working with young people, you're involving experts in different areas. And then we also want the campaign to be sort of presented clearly and in a persuasive way with a good level of professionalism so that we can see how you're taking that forward. And like I say, the global representation point is there. On the next slide, please. So if we haven't answered any questions that you've got already and you'd like to ask a question in using the Q&A function, then feel free to do that now, and myself or our COO Louise might be able to answer, or another member of the Trinity Challenge team. If we go to the next slide, Hamish. Just to let you know that we will be hosting a competition Q&A webinar. So if you don't have any questions right now and you need to go back, digest a little bit about what we've said, and then you want to come and ask questions next week, then you can do that. And we'll be hosting a webinar on Thursday, the 23rd of January at 2:30 UK time. So feel free to go away, talk to your teams, discuss your campaign ideas, and then come back to us at that time. And this is the link that we can share as well in the email that goes out to everybody in the coming days. So I think we can go to the final slide. Have we had any questions?
Yeah,
Sorry, I've just skipped that.
questions in the chat, Penny. Sorry,
Oh, great.
I'll
Okay.
camera on so you can see me. So we've got some good questions around when we say legally registered organisation, what do we mean by that? So I can just quickly talk about some examples. So what we're looking for there is either a university. So if you're a student group and you're part of a university, can the university sign the contract with us and manage those grant funds on your behalf and report back to us at the end? Or you could be working with a registered charity or an NGO in your part of the world that are registered and are able to accept grant funding, and again can sign the contract and manage those funds on your behalf. So we're looking for an organisation that has been registered in the country that your team is working in, and that can enter a contract with us just to make sure that the funds get transferred to the right place, and then we get the reports back on how they're spent at the end. So I hope that answers your question, and we can go into a bit more detail at the Q&A webinar, so if you want to register for that. And then there's another question, Jenny, around can a previous winner of the Youth Summit competition apply again this time?
So the same team won't be able to apply again and win the funding. So we're just trying to make sure that we are supporting different organizations. However, if you're an individual from the previously winning team and you form a new team, then that is absolutely fine. And as part of the new team, you can bid for the funding again. But we just want to make sure that we are spreading the grant funding as far and wide as we can. And like we say, the global representation side of things is really important to us. So trying to connect with new audiences and organizations is what we're really trying to do with this next level, this next round of grant funding.
Great.
Thanks for your question there.
One more question, Jenny, before we move on. Is participating in the events today a criteria for the application process?
So it's not a criteria per se, but if, for example, we had two applications that scored exactly the same and we had no other way of differentiating the two or deciding which one goes forward, then it might be that we look at the summit attendance. And if you were someone who attended, then you would probably be favoured more than someone who didn't. So that's the only really associated criteria. Thanks.
Thanks, Jodie. I think those are all the questions for now. There's a couple of being answered by Hamish in the Q&A functionality. So if you want to move on to the final part, then that'll be good.
Okay, fantastic. Hamish, let me know if there's anything that you need help answering. Oh, right. I'm just seeing, so I can see some of the questions. So one's saying, is it regional based or open to all countries? So it's open to all countries. You and your team from any individual country can apply for the funding and win. But what we'll try and do is have one winner in each region. So we'll try and have one winner from Central and South America, and one from North America, and one from Africa, and one from Europe, based on those questions that based on the regions that we outlined earlier. I can see all the other questions. I think that we're answering all the questions in the chat, so I'll move on to the next slide, which I think is just about the webinar. Hamish, if you can move the slides on. I think he's busy answering the questions in the background, so not to worry. Thanks. So this is just a reminder to say thank you. Thank you for attending. Thank you for giving us your time and your energy and your ideas and supporting the Trinity Challenge and our efforts to engage young people around the world. We'd love it if you tagged us in any social media posts that you want to put out about the summit. You can use the hashtag Trinity Challenge, or you can use the hashtag TTC Youth, and it means that we'll see it, and hopefully we can reshare some of your content as well. If we go on to the final slide, it just shows you our social media handles. So we are on LinkedIn, Twitter, Instagram, and Facebook, and we would love for you to connect with us and follow us and keep up to date on some of the upcoming opportunities from the Trinity Challenge. All the information about the competition and the winning poll. Did everybody vote? Let me check. Okay, we have had 33 out of 33 people vote in, so I will end the poll and I will share the results. Okay, so we had 14 out of 33 people who selected antibiotic stewardship, and we had 19 who selected promotion of biosecurity. So very exciting. We will add these scores to the scores from this morning's poll, and then we will put out an announcement this evening as to which one is the winner. I think it's going to be very close if I remember from this morning. So thank you to everyone who did the poll. And like I say, we really appreciate you taking the time to join us today. We're really trying to connect with young people, youth-led organisations, AMR activists around the world. And we really want to continue to do this, continue to strengthen this global network. So keep an eye out for the competition, and we really look forward to seeing your applications and what comes next. And please get in touch if you have any questions, and we'll see you hopefully next week at the Q&A webinar on Thursday. Thank you to the facilitators as well and team behind the scenes. It takes a lot to put this together, and I really appreciate all the hard work that goes into it. So thank you, facilitators. Thank you, scribes. Thank you, organisers, and thank you to all of our wonderful attendees. Have a great evening, or day, or night, or sleep. Bye, guys.